Tioconazole 1 ointment with prefilled applicator is used to treat vaginal yeast infections. It helps reduce vaginal burning, itching, and discharge that can occur with this condition. This medication is an azole antifungal, which means it works by stopping the growth of yeast that causes the infection. It's important to ask your doctor before using this medication for self-treatment if this is your first vaginal infection. Tioconazole ointment is specifically for vaginal fungal infections, so it may not be effective for other types of infections like bacterial vaginosis. If you experience symptoms such as fever, chills, stomach pain, or a bad-smelling vaginal discharge, it's important to contact your doctor right away, as these could be signs of a more serious infection. The recommended dosage and timing for using this medication will be provided by your healthcare provider. If you are using this medication without a prescription, make sure to read all the directions on the package before using it. If you have any questions, consult your pharmacist. If your doctor has prescribed this medication, use it as directed. This medication is only for use in the vagina. Remember to wash your hands before and after using it, and avoid getting the ointment in your eyes. If it does get in your eyes, make sure to wash them with plenty of water and call your doctor if your eyes continue to feel irritated. The dosage of this medication depends on your medical condition and how you respond to treatment. Usually, this product is given as a single dose at bedtime or as directed by your doctor. It's important to follow all the preparation and usage instructions in the package. You will need to lie on your back with your knees towards your chest and insert the prefilled applicator into the vagina as far as it will comfortably go, then slowly press the plunger to apply the full dose of the ointment. If you have itching or burning around the outside of the vagina, you may also apply some ointment to that area. While using this medication, avoid using tampons, douches, spermicides, or other vaginal products. You can use unscented sanitary napkins during your menstrual period or to protect your clothing from any leakage of the medication. If your condition doesn't improve after 3 days or lasts more than 7 days, make sure to tell your doctor. Also, let your doctor know if your infection returns within 2 months. You may need a different or additional medication to treat your condition. Some common side effects of using Tioconazole 1 ointment with prefilled applicator include headache, vaginal/urethral burning, itching, and pain. If any of these effects persist or worsen, it's important to inform your doctor or pharmacist. If your doctor has prescribed this medication for you, it's because they have determined that the benefits outweigh the potential risks of side effects. Most people using this medication do not experience serious side effects. While it's rare, a very serious allergic reaction to this drug can occur. Seek medical help immediately if you notice any symptoms of a serious allergic reaction, such as rash, itching/swelling, especially of the face/tongue/throat, severe dizziness, or trouble breathing. This is not a complete list of all possible side effects, so if you experience any other effects not listed here, it's important to contact your doctor or pharmacist. If you are in the US, you can report side effects to the FDA at 1-800-FDA-1088 or at www.fda.gov/medwatch. In Canada, you can report side effects to Health Canada at 1-866-234-2345. Before using Tioconazole 1 ointment with prefilled applicator, make sure to check in with your doctor or pharmacist if you have any allergies to it or other similar medications. This product may contain inactive ingredients that could cause allergic reactions or other issues, so it's important to discuss this with your pharmacist. If you have diabetes, immune system problems, or experience frequent vaginal yeast infections, it's important to consult your doctor or pharmacist before using this medication. Also, be sure to inform your doctor or dentist about all the products you use before having surgery. If you're using this product, it's important to ask your doctor about the possibility of having sexual intercourse. Tioconazole 1 ointment may weaken rubber products, so it's important to use alternative forms of barrier protection/birth control during this time to prevent pregnancy. If you are pregnant, do not use this medication for self-treatment. It should only be used when clearly needed, and it's important to follow your doctor's instructions on how to use the applicator. It is unknown if this drug passes into breast milk, so be sure to consult your doctor before breastfeeding. It's important to be aware of potential drug interactions that could affect how your medications work or increase your risk for serious side effects. This is why it's crucial to keep a list of all the products you use, including prescription and non-prescription drugs, as well as herbal products, and share it with your doctor and pharmacist. It's also important to not start, stop, or change the dosage of any medicines without your doctor's approval. If you or someone you know has accidentally ingested this medication, it can be harmful. If the person is experiencing severe symptoms such as passing out or difficulty breathing, it is important to seek immediate medical attention by calling 911. Otherwise, contacting a poison control center is necessary to get the appropriate guidance on what to do next. In the U.S., you can reach out to your local poison control center at 1-800-222-1222, and in Canada, residents can call their provincial poison control center for assistance. After using Tioconazole 1 ointment with prefilled applicator, it's important to take steps to prevent vaginal yeast infections. Make sure to dry the genital area thoroughly after showering, bathing, or swimming. Also, avoid wearing tight jeans, nylon underwear, pantyhose, a wet bathing suit, or damp/sweaty exercise clothes for long periods. Instead, opt for cotton underwear and make sure to change your underwear daily. If your sexual partner experiences symptoms, it's important for them to contact their doctor right away. Today, we're talking about Tioconazole 1 ointment with prefilled applicator. This medication is used to treat vaginal yeast infections. It works by stopping the growth of yeast that causes the infection. The applicator is prefilled, making it easy to use. It's important to use this medication as directed by your doctor, usually once daily at bedtime. Be sure to read the instructions carefully before using. If you have any questions or concerns, talk to your doctor or pharmacist. It's important to complete the full course of treatment, even if you start to feel better. Remember to use this medication at the same time each day to help keep a consistent level in your body. Remember to store Tioconazole 1 ointment with prefilled applicator at room temperature and keep it out of reach of children and pets. Do not dispose of it in the toilet or drain unless instructed. When the product is expired or no longer needed, make sure to discard it properly. You can consult your pharmacist or local waste disposal company for guidance on how to do this. If you need more help, call your doctor for medical advice. In the U.S., you call FDA 1-800-FDA-1088. In Canada, you may call Health Canada 1-866-234-2345. Wishing you good health. Thanks for watching.